How does COVID affect pregnant mothers? Pregnant women have been included in the list of people at moderate risk as a precaution. Two-thirds of pregnant women who contract COVID may not show any symptoms of COVID. Most pregnant women who do have symptoms only have mild cold or flu-like symptoms. But a small number of pregnant women can become unwell with COVID-19, particularly if they are infected in the third trimester. So, if you are in your third trimester, that is more than 28 weeks pregnant, you should be particularly attentive to social distancing, hand washing, etc. In a study in the UK, outcomes of 427 pregnant women admitted to the hospital with COVID-19, most women in the study required only ward treatment and were discharged home. Around 1 in 10 women required intensive care. Pregnant women over the age of 35, those who had a BMI of 25 or more, and those who have pre-existing medical problems such as high blood pressure, diabetes, etc., should be more careful. So what are the symptoms of COVID? High temperature, dry cough or both, loss of smell, severe headache, etc. Get yourself tested immediately for COVID if you have any of these symptoms. Other than this, pelvic pain, cramping or bleeding during early pregnancy are linked to ectopic pregnancy and miscarriage. If you have any of these symptoms, you should seek urgent medical advice so that you can be taken care of. Many women have the question, how does COVID affect my baby? Transmission of COVID-19 from a woman to her baby during pregnancy or childbirth seems to be very uncommon. Studies have shown that there is a 2 to 3 times increased risk of giving birth prematurely for pregnant women who become unwell with COVID-19. Babies of women with COVID-19 were more likely to be admitted to the neonatal intensive care unit, but almost all these babies did well. There was no increase in stillbirth rate or increase in infant death for babies born to women who had COVID-19. So how should you go about with your pregnancy during the pandemic? Wear face mask anytime you step out of the house or if you're expecting any visitors coming to your place. Practice social distancing during your antenatal visits to the clinic or hospital. Scans during pregnancy are an essential part of pregnancy care, and it is important that you continue to attend them for your and your baby's well-being. So get them done at the scheduled time. But again, be very cautious when you go to the hospital. Please wash your hands regularly with soap and water and use hand sanitizer gel. Even if there are no restrictions in place, we would caution against large gatherings. Continue your daily walks, eat fresh and nutritious food, stay hydrated, drink 2 to 3 liters of water every day. So what should you do if you test positive for COVID? If you test positive for COVID-19, you should contact your doctor to make them aware of your diagnosis. If you have no symptoms or mild symptoms, you'll be advised to recover at home. If you have more severe symptoms, you might be admitted to a hospital. If you have suspected or confirmed COVID-19, a discussion about the benefits and risks of infant feeding, including breastfeeding, should take place between you, your family, and your doctor. There's no strong evidence to show that the virus can be carried or passed on in the breast milk. The well-recognized benefits of breastfeeding and protection it offers to babies outweighs any potential risk of transmission of COVID-19 through breast milk. If you choose to feed your baby, the following precautions are recommended. Wash your hands before touching your baby, breast pump or bottles. Try to avoid coughing or sneezing on your baby while feeding at the breast or from the bottle. Consider wearing a mask or face covering while feeding. So, hope you had some information about COVID during pregnancy. Stay safe, stay healthy, practice social distancing, wash your hands with soap.